when you want to develop your career, you think about clinical, you think about medical education, you think about leadership, and you think about research. And this really, really resonated with me. And since then, I've literally been following his advice and curating my professional career that way.
What made you put yourself forward to become a council member on the college?
Oh my gosh. Okay, so if we go back, Erwin, when I talked about COVID and all that kind of stuff, so not only about the professional career side of things, but also to, it's an element of improving representation, differential attainment. I think what we've established is it's a multifactorial issue. Yes, the exit exam is there. What you're being assessed on is everything you've been doing in your training program so far, and not just on the day.
My guest today is Dr. Uwa, a portfolio GP who's interested in helping IMGs. He's got various roles in medical leadership and is also working at the University of Manchester. Hi, Uwa. How are you doing?
Hello, Erwin. Thank you for inviting me onto the podcast today.
For people who might not know you, tell us a little bit about your background.
I was born and brought up in Benin City, which is in the southern region of Nigeria. I finished my medical school quite a few years ago now. So 2006, I finished. And I did some work back home for about a year or two before I decided I was going to relocate to the UK. And I relocated to the UK in 2008. Obviously, the popular route was writing all the PLAB examinations and registering with the GMC. So all that was quite an interesting time. A bit of challenges here and there, which we were lucky to overcome. So I registered with the GMC and I started off doing non-training jobs, really. So sort of non-training jobs, non-training NHS jobs. I did some orthopedics, believe it or not. I did some A&E, accidents and emergency roles, and I did quite a lot of medicine, actually. And along the line with getting used to the NHS and working in different hospitals and different specialties, I actually made up my mind that I wasn't going to be a hospital physician. Eventually, I had decided I was definitely going to be a general practitioner. So, cut the long story short, in 2014, I was successful in getting into a GP specialty training program, which was in the East Cheshire region. So I did my GP training in Macclesfield Hospital. And then some of the practices I did my training in was some in Handford and in Knutsford, and I finally qualified in 2017. So that's a little bit of my background.
Great. You got such an interesting story. And coming to the UK with new expectation, new system, how did you feel about the journey?
I was a little bit apprehensive then. I think something that helped was it wasn't just myself. There was some other of my colleagues and university classmates at the time who were relocating at similar time. In fact, we studied together for our PLAB examination. So I think that community and togetherness kind of helped us to thrive. So we studied for our PLAB examinations together and we sort of passed it together. But actually getting into the system, we obviously worked in different parts of the country and different hospitals. There was that apprehension. And some of the advice and tips that we had was you have to be inquisitive, you have to ask questions, you have to ask anything, and you can ask anybody, because if you're new to a system, you're new to a unit or new to a hospital, the best thing to do is to keep asking questions. I remember once even asking a nurse colleague about prescribing a particular prescription. I was like, well, this is the way we used to do it back in Nigeria. How do you do it here? And she was like, yeah, look at this. She just showed me, I think either the BNF or the memes or something. I was like, this is how we prescribe it. This is the dosage. And asking questions and just doing bits by bits, following instructions, see how people do it. And I found that over time, you start to gain that confidence and experience that sort of helps you plant your foot, really.
Great. So I can relate with your decision as in not wanting to become a hospital doctor. And what was it that made you lean into general practice?
So in all honesty, I think things have changed now. But one of the things was, we were hoping we won't have to work nights or weekends as general practitioners. we were hoping we would work more sociable hours. And those were the things that actually, tipped it for me at the time.
Great. Yeah, I think this social working hour is a big factor in the decision making of many GP trainees I've observed. Now, when you look at your career, were there any key moments that made you become the person you are today?
Yeah, so Erwin, that's a really good question. And I would probably say a couple of moments, and obviously without going in depth into it. So one obviously was deciding to become a GP. But be going through that process, I had to also, even if I had worked a few years already in the NHS, I had to get used to how it was being in a training program. So there's a bit more structure, a bit more expectation. I really had to learn how to put in reflective entries. It's not something we're very familiar with where I went to medical school. But learning how to reflect on cases and experiences and having an e-portfolio which was reviewed by your educational and clinical supervisor at the time. So finishing GP training, it was important to be confident in being an independent GP that you could practice anywhere in the country. I focused on that at the time. Um, Came back to Manchester because I live in Manchester and just did mostly sessional jobs as a locum GP by and large. And I just said, I'll, put my head down, become the best GP I can be. So I was really developing my clinical skills and, clinical career. I did think about medical education a bit at the time, spoke to a colleague who was one of the GP assessors. So at the time when, I don't know if you remember, Erin, but when you're about to get into GP training, there were three stages. One will be your documentation, two was the exam, and three was what we call the selection center. So since COVID, they scrapped the selection center. So I actually trained up to become a GP assessor at the selection center, but I could only do one session. But carried on, developing, also carried on with out of hours as well. I really like out of hours. I was doing out of hours. I was working as a locum GP as well. Then COVID hit and lots of things happened, lots of things changed. There was the whole, issue with BAME being a lot of inequalities with the COVID, the COVID deaths and the disparities. And then obviously happening in the US was the whole George Floyd thing. So lots of things are happening at that time. And I just stopped and thought and said, what could I do? You know, within my own sphere of influence, was there anything I can do to improve things, improve the representation of Black and sort of Asian doctors or GPs and other, ethnic minority GPs? And at the time, there was a call within the college to join certain task groups because there was a thing the college was trying to develop a BAME action plan. That's all changed now and is now under the broader umbrella of EDI. I joined some of these task groups. Again, joined lots of webinars, was consistent with joining my local faculty. So one pivotal moment, I did mention this at I was a keynote speaker at a diversity conference the other day, and I mentioned this. One pivotal moment was the moment where I stopped thinking about these as a job and salary, and I began to think of it as a career. There's nothing wrong in thinking of it as a job and just having salary, but I think we're all at different stages in our journeys, life journeys, and profession. So I stopped thinking of it. This is not just a job, but this is my career. And what really helped was there was a webinar I attended. I listened to Professor Mayo Lakani. He used to be a chair of the college and the president. And he just said there's a setting where you can curate your career. This won't work for everyone, but it really resonated with me. And he said, when you want to develop your career, you think about clinical, you think about medical education, you think about leadership, and you think about research. And this really, really resonated with me. And since then, I've literally been following his advice and curating my professional career that way.
That's so powerful. Yeah. When you think about these four core pillars, where would you say you do more of, and where would you do more of in the future you'd like to?
So the way I also see it is the bedrock, for me at least, it might be different for others. For me, the bedrock and underlying thing would be clinical. So it's really important to keep seeing patients. because I think that helps you deliver the others. So you're able to teach based on what you are seeing and practicing in clinic. You're able to be a medical leader based on what you've seen, in clinic. Again, similarly with research. So for me, I think clinical will be an underlying running theme. And then from there, you then develop one or two portfolio careers, but more specifically, medical education for both postgraduates and undergraduates, medical leadership, depending on which direction you want to go, and quite importantly, research as well.
That's powerful, yeah. I think thinking about this framework early in somebody's career is helpful because it takes a while to get in a good career where you feel you're enjoying it. So, medical education plays a big part in my career. I don't know about your career. How did you develop your role in medical education? You mentioned already you became an assessor.
Really interesting, and I would say I'm still evolving and developing it, but I think I've come a fair bit of way, and I'm pretty certain what I want to do next, which I think is really important. So for me, I think my first main step, again during COVID, was to get involved with supervising GP trainees in the out of hours setting, in the urgent and unscheduled care. So like I said, I carried on working in the out of hours setting, and there was a time they asked, they're looking for GPs who can be supervisors. Who is interested? So I put my hat in the ring, got the training for it, and since then I've been looking after trainees when they're doing their out of hours session. Some sessions I'm supervising up to 3 trainees in that session. I really find that enjoyable, to be honest, when I do that. So that was a way to also get involved with, to some extent, postgraduate education, to have an idea of what's expected of our GP trainees in the out of hours setting, and a bit of a taste of the consultation skills they need to pass their exam. So that was useful. About similar time, I thought it might be important to get involved with undergraduate medical education. I'd had some training even as a GP trainee on how to teach medical students. So I tried to resurrect that and try and link back into that. And I did the training to become an OSCE examiner. So I could do OSCE exams for year 3s, year 4s, and year 5s. So there's undergraduate, there's postgraduate. Again, in that same line, I was trying to see what else can I do with getting involved with the university. I applied for 1 or 2 roles, didn't quite get it, and I sat back and I said, what else could I try? I tried not to give up. So really recently, last year, got again involved with colleagues who wanted more involvement with undergraduate medical education, and there was an avenue to become an academic advisor. And I put in my CV, had a chat, connected with them, and I'm now an academic advisor for the year 3 medical students in Manchester University. So this is really, really key. I'll mention one other thing. Like I said, there's a few things with medical education, or a couple of more things. I am on the path to become a GP trainer, but for certain reasons, I didn't do it before now, and I'm not that much in a rush, so I'm taking my time. The first phase I've done is becoming a clinical supervisor for foundation doctors. And in my region, they've merged that with becoming a clinical supervisor for the wider workforce. So you can supervise clinical pharmacists. So I've done that training. So I am a supervisor for that as well. And the last thing I'll say is very recently I became an MRCGP SCA examiner as well. I would say baby steps, but I think I'm getting that good picture of how I want to curate becoming a GP educator, to be honest.
So you've actually taken various roles, and what do you think made it possible for you to get the role as an academic advisor after you applied? What were the changes you think after you didn't get it a few times before?
Yeah, I suspect it's some of the other bits and bobs I did with regards to medical education. So even if it wasn't with regards to medical students, but I think that trail, kind of, I think, put things together, and I seemed like an interested candidate, if that makes sense. So I'd mentioned I had done some of their training even as a GP trainee. I was an OSCE examiner, and then I touched on the postgraduate medical education I was involved in. and just sort of expressed my passion really to be part of the team. I think that helped.
That's great. So then, what made you put yourself forward to become a council member on the college?
Oh my gosh. Okay, so if we go back, Erin, when I talked about COVID and all that
Yes,
kind of stuff, so not only about the professional career side of things, but also to an element of improving representation, for some of us. I got more involved with the college, got more involved with the local faculty, and the opportunity to become a council member came available, and I thought long and hard about it, and I felt this might be a good avenue to improve or increase the representation of GPs, particularly grassroots GPs. And again, that would help my activity, not activism per se, but activity within the college, and to sort of express and show my passion for the profession as a whole.
that's great. Yeah. I think there seemed to be a disconnect among the grassroots GPs and what the college is doing. But it is difficult with the college being such a complex organization. Tell us, what are the changes that you have seen in the college while being a council member?
So there's been quite a few changes, and I do agree with you, Erwin. And it's also a challenge for members to see some of these changes that have taken place over the last few years, and which is something the college is really interested in doing. There's something the college took up a couple of years called member value proposition, and this was to try and reevaluate the benefits that members get from the college, and not just reevaluate, try and revamp it as much as possible and let members be aware that actually the college is really interested in you seeing and feeling that you're part of this membership organization. So that's something the college took on board. The college, particularly the officers and our leaders at the moment, the past couple of years have been really, really expressing compassionate leadership and have really listened. They've listened to different sects and factions of the college and college reps as well. So that they are really listening. They take things on board. They have it discussed at different meetings and they try and execute it. So they are really listening. For instance, there've been, I can't really cite any specific examples about it, but there's some scenarios where we would explain or express what members are feeling. And even if they can't do anything about it at the time, they would acknowledge it. They might bring it up in meetings, they might bring it up in different sorts of policies, but they definitely would take it on board. And sometimes they would then include it in a newsletter that comes out the following day just to let members know. I think one example would be the problems with getting when local GPs were struggling with work. I think they are still struggling with work, but there was one or two newsletters that I think is not something that's popular, but it had to be done. So the chair had to actually comment and acknowledge that they're aware of the problems that are happening and some of the things they're trying to do, because it's a system problem. It's not just a college problem or a regional problem. So some of the things they're trying to do it on at a system level with the government, which the NHS and things like that.
So, your work has been quite centered among helping the IMGs and mentoring IMGs as well. Now, as a new role as a SE examiner, have you actually been thinking differently, as in what's the problem IMGs are facing when it comes to their exit exam?
So that's an interesting one, Erin. And with your wealth of experience in coaching colleagues with the SCA, I'm sure you've noticed quite a lot. I think one thing, which is what as a very experienced lead examiner keeps saying, is we have to try and help our colleagues and IMG colleagues understand that the exam, most importantly, the examiners are not against them. It's not an antagonistic relationship. In fact, they want people to understand what the exam requires, and they want them to be empowered with what it needs so that they succeed. So a mindset change, we're hoping we can help ourselves with, is the exam and the examiners are not against candidates or IMG candidates at all. So I think that mindset affects. And I think the other thing is many people refer to it as there's an aspect of the exam that has to do with a cultural change, or not culture change, but a cultural aspect of dealing with the British patient or British population that has to be involved and assessed in that exam, which I'm sure you know about as well. So with regards to, I know you've not mentioned the word, but differential attainment, I think what we've established is it's a multifactorial issue. Yes, the exit exam is there, but actually what you're being assessed on is everything you've been doing in your training program so far, and not just on the day. So it's a multifactorial problem. But the exam team, I'm relatively new to the team, but the exam team is well aware of differential attainment, well aware of the fact that some of these things are happening, and they're doing everything they can to make sure that differential attainment is reduced to a bare minimum.
It's quite difficult and discouraging for some GP trainees who fail multiple times, and sometimes they feel this exam is subjective and they feel like it's not fair for them. However, there are things that GP trainees can do to increase their chance of passing, and knowing that, yeah, the examiners are there to assess, but they can't read your mind as well. So you have to show them that evidence you are actually able to practice as an independent GP. And sometimes people, they are a little bit clouded and they don't understand. And I think the college website has got a lot of good information about what exactly examiners are looking for.
I do agree with you, Erwin. Not many, or actually, I've come across some people who would not refer to the college website first, and that should be your first point of call. Look at how the exam was, set up, look at what they're actually looking out for, look at the cases and the criteria, and then watch the sample videos. I think that's where, candidates should start from. But I constantly give kudos to you and your team, Erwin, for all you do for GP registrars, particularly the IMG GP registrar.
How would you like to have a playbook that over 200 GP trainees have used to pass SCA exam? If you'd like to download the free copy of the SCA blueprint, click the link down in the description and you get a free copy, and I'll also give you daily teaching for the next 7 days. Click the link and you get it for free. But let's talk about, for somebody who currently feel a little bit lost and they feel a bit demoralized, they're thinking they want to go to Australia or Canada, what would you say? Because we're seeing a lot of people like that.
Yeah, so that's a very interesting one, Erwin. And I think it boils down to being a personal decision. I'll be honest with you. It boils down to being a person. Yes, there's been lots of challenges, and I think those challenges might still be with us for some time. Change, they say, is the only thing that is permanent. Some would also say tough times don't last, only tough people do. I personally would not criticize anyone who decides to emigrate. You just have to look at your personal circumstance, the family, or where you see your profession in the next few years, and and then go for it, to be honest. Who knows if both of us will be here tomorrow, we don't know. But for now, we're here, and we just do the best we can day by day, whilst we support our colleagues.
Yeah, I think when it comes to how general practice is in the UK, it's not as attractive as other parts of the world right now. Um, but I think what your story has shown, Uwe, is that if you change yourself, you do attract new opportunities. If you don't find these opportunities, you can even create them. And you've done that, and you've come to a place where you do enjoy your career from what I'm sensing. So, what piece of advice would you give to a GP trainee right now who's thinking, I don't know what I'm going to do next? There's no job. They don't feel like it's going to be a good career in the long term. So, tell them, what would you have wanted to hear back then when you were still struggling?
I mean, there's a couple of things, and just without going down a list of things, I think one thing would be to try your level best to get a trusted mentor. Yes, who can support you with the training and the exams and all, but also who may be able to point you in the right direction with regards to your professional career. So some people even have multiple mentors, but get 1, 2 trusted mentors within the profession. It doesn't mean you want to be like them or you're going to be like them, but these are people who've gone ahead of us and they're happy, like you said, and they're successful in the GP profession. Get a trusted mentor that you can rely on, ask questions, have a catch up now and again. Doesn't necessarily have to be a GP registrar having a mentor who's a GP. I've had a couple of colleagues who've possibly been GPs for maybe a few years, who's reached out and said, do you mind just giving me a bit of a pointer? That's also possible. We're all here for peer support. So definitely get a mentor as much as you can. I think the second thing would be find a way, it might be linked to the first, but find a way to stay networked so that you're able to get as much information as possible with regards to jobs, with regards to opportunities, with regards to what's out there, with regards to what people are doing to get by. Just really be inquisitive, get yourself out there. You don't have to be a social media guru or anything like that, but just really position yourself, where you're getting all the information required for your current stage of your career. And those will be the two things I would say.
That's great. Yeah, I think what you've said is very important. The people you hang out with are going to shape your mindset, and they're going to shortcut these years that you get that success sooner. I want to touch upon the election because you were re-elected with the college council. So it means that people appreciate what you're doing. Tell us a little bit, how does it feel about going in the election process?
So the election process, so you get vetted, for lack of a better word. So you put in your application, so you have to do a whole thing of declaration of interest and all that stuff. So there's a time frame and a timeline. So you put in all that, you get vetted, and then they say, right, you're approved to stand for the council elections. And they tell you again a bit of the timeline. So the ballots will be open from this time to this time. You can canvass from this time to this time. You have the canvassing rules as well. By now, hopefully you have a bit of idea of, how many times they meet in council and what's expected of you if you become successful. I think the interesting time is the canvassing period or the balloting period or when the voting opens, so to speak. Sometimes it's 3 weeks, sometimes it's 4 weeks. And the question always comes, what am I going to do to A, make myself stand out, B, get people to even know there's an election going on and be interested to cast their vote. And people do different things. So just go back a little bit. So when you have been vetted to say, yes, you can stand, they would ask you to put in a personal statement, two slightly, so a shorter one and a longer one. So one that would go out for people to see. And there's an option to do a short recording as well, which would all be on the voting website. So when people go in, they can see. And then again, so just going back to what people do. So social media is quite useful, it's quite helpful, I think. So which would include WhatsApp, Telegram groups, LinkedIn, Twitter or X, Instagram, Facebook and all that stuff. So I have actually found them useful, or any of these groups or GP groups. I found them useful. But one thing is good, if anyone is interested in standing, I would say it's good to have a message or something you feel like you will be able to do or you're hoping to accomplish that will be very relatable to our members and our colleagues. So I think that would be my word on that.
Great. So it sounds like it is quite a lot of effort to actually run for that election. And in the future, what are the things that you're looking forward to accomplish as part of the college, Uwa?
At the moment, in fact, recently I tried to do a little bit of, I'll say reorganization or just sort of reviewing where I was up to, so to speak, particularly to do with my input and work with the college. For now, it's my second tenure as a council member. So I want to keep representing colleagues, grassroots GPs. I want the college to be aware of what's happening on ground. I'm going to keep pushing for that, and I'm going to keep doing that as much as I can. Secondly, I recently became the chair of the Northwest England faculty, sort of a few months ago. I'm also wanting to focus quite a bit of my energy there to see how we can develop our faculty and get more people involved, run more events just to help with the engagement, and possibly, CPD events as well. Just so our colleagues, members can see some benefits from the faculty and the college. So these are the two things I'm working on at the moment. I'm not too certain on any sort of 5-year plan or 5-year vision and things like that. And that may come up later, but for now, these are my focus.
That's great. So you're focusing on locally first, and then maybe in the future you look at national. Great. I mean, it's been really interesting to hear your story. Is there anything that we haven't touched you'd like to talk about?
I guess for completeness, with regards to what we mentioned about those 4 pillars, curating things. So another thing which I've gotten involved recently with, which I'm quite pleased because I was wondering when and how, is with my practice. I've become the clinical research lead for my practice. It's baby steps because I haven't done research in a really long time. But I'm engaging with our local sort of regional NIHR office and colleagues, and we're hoping to get involved with some research, for our patients and our region over the next few months. We recently got signed up to one. It's called the CKD project, so I'm really hopeful for that. It's not quite research, but it's a project that will be really useful for sort of improve the care of our patients who have chronic kidney disease. So I'm really pleased that I'm now ticking the box for research. I thought I'll mention that.
That's great. Well, congratulations on taking all these roles and driving things forward. Where can people find you, Uwa?
I'm on all the social media handles. I'm on LinkedIn. Just search for me, Uwa Ima-Edomwonyi. I'm on Twitter as well. I know not many people are there at the moment. On X, I'm on Instagram. But I would say if you want to reach out to me on any questions with regards to our profession, just find me on LinkedIn. If you're not on LinkedIn, then Twitter or Instagram. Happy for you to direct message me on either of them.
Thank you for sharing your story today. Let us know what was the most valuable nugget you've got from Dr. Uwa today. Write it down in the comments, and if you want to reach out, I'll leave a link for his LinkedIn in the description. Take care, everybody. Bye-bye.